Hi, I'm Amber, your early interventionist.
Hi, I'm Megan.
Awesome. I understand that your child has Connexin 26. Do you know what this is?
Yes, the doctor told me that it was an autosomal recessive disorder, and it causes deafness.
Right, it does. Can you give me like a brief overview of your case?
Yeah, so he was born and he failed his newborn screening bilaterally, and then we went and got further testing, and they told us it was Connexin 26. And my whole family is speaking. None of us have hearing loss at all, and so we kind of want him to be oral and to be able to talk and use English, but we want him to be able to maintain a deaf identity because I've seen some like documentaries and stuff and heard a little bit about the culture, and I know it's really important.
Okay, so in order for your child to be bicultural, they'll have to be bilingual, of course, right? Okay. And in order for them to be bilingual, early intervention is crucial so that they can be exposed to both sign language and speech. Now, have you heard of an IFSP?
No, I haven't.
Okay, well, this was mandated by IDEA, and it's the Individualized Family Service Plan. And through that, it'll guide you along the way with what the child needs to learn and when. And incorporated with that would be the speech therapist and audiologist and different things in different therapeutic areas. Actually, our speech therapist is here today, and of course, you'll have to meet with them regularly so that the child can learn speech as well as sign. You want me to bring her in?
Yeah, that'd be great.
Okay.
Hi.
Here's Lydia.
Hi, I'm Lydia.
I'm Megan. Nice to meet you.
Nice to meet you. I've been looking over your case file, so I understand you want your child to be oral, right?
Yes, but I want my child to still maintain a deaf cultural identity, I guess.
Okay.
But yeah,
I
all
know,
of us are
that's
speaking. So.
That's definitely possible, and yes, definitely since the family is hearing, it would make sense to try to incorporate the oral route too. So I guess the first thing we need to talk about is amplification. Now, do you know what that means?
I'm assuming like hearing aids or...
Right. Okay, so you have several options. So we're going to always start with a hearing aid, right? And a hearing aid pretty much works as a big amplifier. So your child's going to wear it on their ear, and sound's going to come in, and it's just going to, boost it up so that they can hear better. Now, that doesn't always work in all cases. I know your son has a pretty severe loss, and so sometimes the hearing aid just isn't strong enough to get the sound all the way up to, a loud enough level where your child can hear it, but also not, scare him to death. So if we, do a hearing aid trial and we see that, he's not really getting the sound that we need him to, develop speech, we can move to something called a cochlear implant. Now, that sounds a little scary. It does involve surgery, but what happens is a surgeon would go in and put something called an electrode ray inside your child's cochlea, which is their organ of hearing. It's way back in the inner ear. And the child would then wear a microphone on the outside, and then there's a piece that magnetizes to the implant inside their head. And it takes in sound like a hearing aid would, but it converts it a little bit. So a hearing aid would take acoustic signal, just like you and I would hear. And your child with a cochlear implant would have electrical signal, which sounds a little different. So if we went with this option, your child would need some therapy, more so than just with a hearing aid, to kind of learn how to understand the different signal. Now, in order to get it, your child will need to be at least 12 months of age, so we're not quite there yet. And we're going to have a hearing aid trial like we talked about before, and a severe or a profound hearing loss, which your child does have. So your child is hitting the benchmarks for that.
But we won't know until after the trial with the hearing aids whether...
Right. I mean, there's definitely a chance that the child does very well with the hearing aids. So we'll do at least 3 months with the hearing aids and kind of see where that goes. And if we're thinking that we're not real happy with it, we'll start the process of you meeting with surgeons and just checking off all the boxes to get there. But we're not there yet, of course. Okay. And you need to take time to think about it because, surgery is a big decision.
Right.
But it's really not that invasive of a surgery. So anyway, you'll talk to a surgeon about that more if we get there. So either way, we're going to do some oral rehabilitation with your child. Of course, if you approve, but I would highly suggest it. And we do things in there just to teach them how to learn to listen because, a normal hearing child, comes out, there's sound everywhere. But your child is not hearing a whole lot right now, and so they need to learn to focus in on things in their environment. Okay. So that'll be part of the early intervention, like Amber was talking about. And so I think in the beginning we will meet more often, but as your child progresses, we'll hopefully get them graduated from speech therapy and working great. So I can't wait to meet him.
Yeah. So have you considered the educational route with the cochlear implant? It opens more doors for different options that you can choose for educational institutions. Do you know about those?
I'm not even there yet. So
yeah. Okay, well first we'll start off with a preschool that's customized to his specific lifestyle that you want, and that's bicultural, right?
Right.
Just down the street at TSD, they have a total communication preschool.
They do. They offer speech therapy services as well as signing.
Right there within the school. So, and it'll be great for him. And we'll enroll him in that if that's what you want, especially since you want him to sign, right?
Right. I do, yes.
Okay. And he'll also be a part of the deaf culture and community there, and he'll be surrounded by role models and adults and different people who are deaf, so that would be great for him too.
Right.
There's of course other options as well.
Yeah.
I'm sure that your local county schools have preschools that can accommodate his needs. So, we'll work together and find a place that's, really you're comfortable with. We'll shop around, you know.
Right. Yeah. And also, whenever he gets to the age to where he can attend actual school, like kindergarten and stuff, there's two different ways that you can take. There's mainstreaming, and then there's residential/day schools. Day schools are just like TSD or residential schools, and he'll be exposed to sign and speech all day. Mainstreaming is a little different. He will be able to have an interpreter if he wants, but it's more mainstreaming as he goes to a normal public school. Does that make sense?
Yeah.
Okay.
So if he well, I do want him to learn to sign, but if he is doing well with the oral speaking and using, I guess, hearing to a certain extent, he can learn in that
environment.
Well, right?
Yeah,
it's definitely possible. We can set him up with some assistive listening devices in his classroom. So if he's doing really well with hearing and speaking, there's ways that we can put a mic on his teacher and then have the input that goes into the mic go directly to his hearing aid or his cochlear implant. And so it's like he's sitting right with the teacher, but he's sitting, in the classroom.
Right.
And so there's a lot of little devices like that we can do that would make him successful, hopefully, in the mainstream if we went that route.
So, do you feel comfortable with this stuff as of right now?
I think so. I mean, education, he's a little far off from that, but it's good to hear about it. And
and we'll revisit that in the future too.
Definitely.
Yeah.
And as far as his early intervention, here in the next couple weeks, we'll have your IFSP meeting, and we'll meet with I'm not sure about any other developmental things that are going on with him right now, but we'll we'll talk and we'll figure out what, needs to go first in his, young education, and we'll get him going.
Okay, perfect.
Right.
Thank you, guys.
I look forward to working with you.
Yes, thank you.
Thanks.